Good morning. Buenos días. Dobre utra, for those who speak Russian. I am Jose Abar. I am president of Richard J. Daley College, and it is my pleasure to welcome you to the Arturo Velázquez Institute, which is our secondary training and educational facility for Richard J. Daley College. Since we are a small institution, and I say small in the not true word, we're only 18,239 students total in headcount. So we are a good mid-sized institution, close to a university in terms of size. And we're proud of being able to host you here today's Chicago Cancer Health Equity Collaborative Press Conference and Community Forum. It is indeed my pleasure to introduce Dr. JABBAR BENNETT to kick off this event. Dr. JABBAR BENNETT.
My name is JABBAR BENNETT, and I serve as the Associate Provost for Diversity and Inclusion at Northwestern University. And as Associate Provost and a faculty member in the Department of Medicine at Feinberg, I am extremely pleased and couldn't be more happy to join you on this occasion. We're here today to kick off a new $17.4 million grant from the National Cancer Institute that will create ChicagoCHEC, the Chicago Cancer Health Equity Collaborative, which is a shared commitment between the Robert H. Lurie Comprehensive Cancer Center of Northwestern, the University of Illinois Chicago, and Northeastern Illinois University. Through this partnership, we aim to advance cancer health equity through meaningful scientific discovery, education, training, and community engagement. We firmly believe that everyone should have the opportunity to attain their highest level of health, and together we will absolutely improve access to cancer prevention, early detection, and treatment. Now let's get started. I want to invite to the stage Dr. Leon Planadius, Director of the Lurie Cancer Center, Dr. Michael Emeritus, Chancellor of the University of Illinois Chicago, as well as Dr. Sharon Hawes, President of Northeastern Illinois University, to open up the event with brief remarks. Dr. Planadius.
Good morning. As many of you know, in the field of oncology, there have been remarkable advances over the last few years. Advances in technology have resulted in important discoveries, personalized cancer therapies by analyzing genes, molecularly driven therapies, and we are at the verge of finding cures for many cancers. But there is one important problem, that not everyone is benefiting equally from these breakthroughs. According to the NCI, the state of Illinois has very high cancer death rates among other states. Importantly, some communities are hit harder than others. The data from the Illinois Department of Public Health shows that the Chicago areas of low income or predominantly African American or Latino communities have cancer death rates double the national average. Let me repeat, double the national average. This will not be happening. So at the Lurie Cancer Center, as a comprehensive cancer center, see as a very important mission of us to contribute to efforts to bring health equity. We are very excited about this award, working closely with our partners and friends at the University of Illinois and Northeastern University to make a difference. Thank you.
Good morning. It's a pleasure to be back at the Arturo Velázquez Institute once again, and it's a pleasure to represent the University of Illinois at Chicago for this morning's announcement. The CHEC grant from the National Cancer Institute is an example of support for scientific innovation that can help address some of the growing cancer disparities in Chicago. UAC is proud to play a unique role in this project. Quite frankly, when we were presented with the opportunity, we had no choice but to participate. We are Chicago's public research university. We have a major academic cancer center, and we are one of the most diverse campus communities in the nation. And this is why when people in this area, in Pilsen, in Little Village, say La Universidad, there is no other designation needed. We know what university they are talking about. Our educational enterprise mission that we bring to the table is integrated with our comprehensive hospital and health sciences system, the state's only public hospital in Chicago, where our facilities can provide state-of-the-art treatment and clinical trials. And our UIC Cancer Center is committed to helping residents of our local communities, particularly those who are medically underserved. And we have made it our primary mission to address these disparities, specifically in cancer risk prevention and treatment. Whether it's access to care, access to clinical trials, cancer screening, information about preventive behaviors, we engage directly in our communities, not only to study these issues, create workshops and write papers about them, but also to communicate back to the communities and support the needs of these communities, because we are determined to make a difference in Chicago and we want to have a greater impact. I would like specifically to thank Dr. Rob Wynn, who is the director of our Cancer Center, as well as the leadership of Northwestern and Northeastern universities for participating in this project. One of the main points that I have stressed as part of USC's vision is a commitment to innovation in action. I'm enthusiastic about the opportunities that this grant is presenting for innovation in action, and I'm enthusiastic about the opportunities presented for all three universities, for our students, faculty, and researchers, but primarily about the constituencies that we serve all across Chicago that are impacted by cancer. So, delighted to be part of the celebration today. Thank you for having me.
And good morning from Northeastern as well. I'm so pleased to be part of this historic event in which Northeastern Illinois University, along with Northwestern University and the University of Illinois Chicago, can join forces to address a significant problem of cancer inequities in our community. We're each unique institutions of distinction, but when we work together, the results can be powerful and life-changing. And indeed, Northeastern has a lot to contribute to this partnership. As the most diverse regional public university in the Midwest, Northeastern has a long-standing tradition of enrolling and graduating minority and non-traditional students, many of whom we are able to point towards successful careers in health and cancer research. We also have a well-known track record of community partnership and engagement in the Chicago area, and especially when it comes to social justice and economic inequality. In fact, this focus on cancer health disparities in underserved communities fits extraordinarily well with Northeastern's mission. So as a partner, Northeastern is committed to supporting the Chicago Cancer Health Equity Collaborative by matching our strengths with the collaborative's mission to advance cancer health equity through meaningful scientific discovery, education, training, and engagement. I want to recognize the hard work of all of the partners in creating the grant proposal, in creating this opportunity for Chicago. I want to thank them all the partners, for the good work that has gotten us to this point. And actually I want to thank them for all the hard work to come, because there will be much work. It will be worthy work. Northeastern is proud to be a part of the collaborative and to share in the effort to build healthier communities and citizens. Thank you so much.
And let's thank all three of the speakers once again. Now let's turn the stage over to the amazing ChicagoCHEC leadership team, who have for the past 5 years worked tirelessly to bring forth their vision of a unified Chicago-wide center to advance cancer health equity. We have Dr. Rob Wynn of the University of Illinois Cancer Center, Dr. Christina Sasirski of Northeastern Illinois University, Dr. Morris Stewart of Northeastern Illinois University, and Dr. Melissa Simon of Northwestern.
Oye, that's all I can say. Buenos dias, thank you for coming. Mil gracias, really. This is a dream come true for me. Eso es la razón que soy doctora. This is why I went into medicine, really is. I grew up in the bottom 1% in this country, and I saw my family experience health and healthcare disparities firsthand. And I was committed from that point onward to do something about it. And I started when I came here in Chicago as an undergrad at the University of Chicago, leading and organizing the Latino Students Association, really trying to work on the ground and creating a lot of these community partnerships that represent organizations that are here in this audience today. So, wow, es un sueño, really. I've had the privilege and to really have a lot of amazing Chicago health leaders and advocates contribute to who I am today, to my education, my mentorship, my training. And that includes Dr. Stephen Whitman, Dr. Quentin Young, and Dr. Linda Murray, who's in the audience today. So thank you. I do agree with all of you, everyone in and no one out. You know, the need for this type of grant could not have come at a more important time. The American Cancer Society this week just released new breast cancer screening and mammography guidelines to yet complicate the decision-making and understanding of not just my patients and everyone and their families, but also healthcare providers in the healthcare system. And while these guidelines were based on large databases and research, there remains a wide gap in who participated in these databases and in these studies that inform these guidelines. We need more research that is inclusive of all populations, regardless of color, ethnicity, religion, gender identity, sexual orientation, ability or disability, and the list goes on. Without research, education, training that emphasize, advance, and promote diversity, equity, and is partnered with community, we will not achieve true population health, which is the end game goal, right? Now, I know there are a lot of people and organizations in this room who gathered here today who've been working tirelessly to end health inequities. And this grant is just one part of it. It's an epic coming together of multiple institutions with unique and complementary strengths to form the first of its kind partnership across these institutions that will support, build on, and catalyze all of your amazing work that you've already been doing on the ground here in Chicago, and create the kind of movement we need to eliminate cancer health inequities right here in our neighborhoods. ChicagoCHEC will change the game in many ways.
Thank you, Melissa, and I am honored to be part of this collaborative. This is the first cohesive effort between our three institutions. We're at the forefront. Everything we set to achieve at our great institutions, whether that's research, education, or training, or advocacy or patient care, is specifically designed to engage and improve the health of our communities. Thank you.
Thank you, Laura and Melissa. This is the first partnership of its size geared toward a unified mission of advancing cancer health equity. The ChicagoCHEC partnership already includes more than 20 researchers and educators from diverse backgrounds and academic disciplines that cross 14 departments and 17 schools from all three institutions. This is the first collaborative effort between NEIU, UIC, and Northwestern to scale health and cancer research career opportunities across our three campuses and beyond our three campuses in order to meet the needs of minority, underrepresented, and first-generation students. Thank you.
You know, there are some days that are actually truly miracles, and this is actually one of them. As Melissa just told you, she is a descendant, a Latina. from a disadvantaged background. And on the same stage, you have an African American whose mom had me when she was 15. She's not embarrassed about that, neither am I. Who was apparently born into, say, poverty. But the reality is I had much love and many dreams. And to be part of this team, representing the University of Illinois, whose mission is to be focused on a community, an elevator school, and the concept of taking people who like me, who may have had no chances, and giving them a leg up, that I'm a part of this team is incredibly humbling. But what's much more of a miracle is that not that we stand before you here, but that we've moved from the yes we can era to the let's just get it done era. And we're gonna do that. So I think with the team that we have here, with putting the community, not just thinking about the community, but putting the community first, as our first thought and as our last thought, and in the middle, and making certain that our civic leaders, and Reverend Slim and others who are here, are partnered and they have a voice at the table, is a new academic model of not just chasing academic excellence, but making this academically relevant to people. That is the miracle. That is the leader of the 21st century. And in fact, to be honest with you, when we come a year from now, 2 years from now, we'll be talking about not what we thought we could do, but what we've done. And that I am incredibly happy about. So without further ado, that would be Melissa. I think we now go to announcing our, okay. Now we have some amazing people who have joined us in this celebration. And the first one will be Stephanie Logan, a cancer survivor and a patient advocate, and we'd like to hear a couple words from you.
Good morning, ladies and gentlemen. Wow. Wow. My name is Stephanie Logan, and I am a 2-time cancer survivor. And I stand before you today as not just a survivor, but as a patient advocate. And that is a role that I'm honored to have, but that a role that I take very seriously. As mentioned, I am a 2-time cancer survivor, but when I was diagnosed with cancer, I remember the nurse coming into the examining room and saying to me, she gently took my hand and she said, "Don't worry, having breast cancer is like having diabetes." And I was like, really? But I knew she was trying to tell me that it was something that was treatable. But I was amazed at how much an epidemic breast cancer has become. It was during my cancer treatments I was informed that I was underinsured. And that was a concept that was foreign to me. How can you be underinsured? What does that mean? But it was the affiliation between UIC and American Cancer Society that led me to the resources that I needed in order to continue my treatments at UIC that would ultimately save my life. But I often wondered about those who don't have or don't know about the resources that are available to them. As a hairstylist for more than 30 years and a travel professional for 9, I speak to a lot of people on a regular basis. And in doing so, it still amazes me when someone tells me they don't do self-exams or they don't go to regular doctor visits because they're afraid of what the doctor might find. That is the most craziest thing I've ever heard. But yet, people still feel that way. So, what I've come to realize in those conversations, that there are some common denominators. Lack of information, lack of understanding of the information, lack of knowledge of the resources, and then there's simply fear. So then the question becomes, how can we build stronger relationships between the community and the hospitals? UIC has had events that involve various cancer organizations, patients, staff, and the communities. These events help build relationships. The stronger the relationship, the deeper the trust. The deeper the trust, the more engagement between the organizations, the communities, and the hospitals, which can lead to better results. I believe in creating regular events around the city that will engage communities as well as community leaders. Could be a step in the right direction. No one should ever have to suffer with cancer because of lack of resources nor quality of care available to them. Because of the resources that were available to me, I'm cancer-free again. And while I'm ecstatic to be able to say that, I also believe it's my responsibility to utilize my experience to ensure that others have the necessary resources they need to also be victorious with their fight against cancer. So I'm excited to see some of the most dynamic hospitals represented in the room here today. And I know each one of you will contribute your very own level of expertise to this project that will ultimately decrease the health disparities, thus saving countless lives. Thank you.
Next person that you will be hearing from will be NIKKI HARVEY, who will be standing in for Honorable Danny Davis, the U.S. Representative of the 7th District, who wished he could be here today, but to be honest with you, I love NIKKI, so this is great.
Good morning, everyone. I am excited to be here with you on today. I am simply elated. I'm NIKKI HARVEY. I'm the Deputy Director for the Office of Congressman Danny K. Davis of the Illinois 7th Congressional District. He would love to have been here with you today, but he is here with you in verbiage because he sent me a great statement to share with you. More than 1 million people in the United States receive a cancer diagnosis each year. Cancer is one of the most devastating illnesses that one can experience. The very first screening test widely used for cancer was the Papa Colonna test, better known as the Pap smear. Because of that widely used test, the cancer death rate in the United States declined by 70% due to early detection and research. Therefore, we need to do everything in our power to provide treatment and to continue research for the cure. Congressman Danny K. Davis commends the University of Illinois, the Robert H. Lurie Comprehensive Cancer Center, and Northeastern on their great collaboration. Now, all of you know the congressman and know that he is a great lover of poetry, and if he was here today, as he would take his seat, he would share with you that life is just a minute, with only 60 seconds in it. Forced upon us, we couldn't refuse it. We didn't seek it, nor did we choose it. But we give an account if we abuse it. Just a tiny little minute. However, we are blessed to have the ChicagoCHEC partnership in it. Thank you.
Thank you so much. The next voice you'll hear from is Suzette McKinney, and she is our new director of the IND. And in fact, I would, normally should say clap for that, because it really is amazing.
Good morning, everyone. Thank you, Dr. Wynn and the ChicagoCHEC Partnership, and let me also pause to say thank you to Ms. Stephanie Logan, not only for your advocacy, but your willingness to share your very compelling story. Good morning, everyone. As Dr. Wynn said, I'm Dr. Suzette McKinney. I'm the new Executive Director of the Illinois Medical District. I'm so pleased to be here with all of you today. It is both an exciting and an urgent time in our city and our state as it relates to healthcare reform and the response to the health inequities that continue to increase. As the new Executive Director of the Illinois Medical District, I am proud to stand alongside such a brilliant group of innovative thinkers who have crafted a comprehensive response to the cancer burden that continues to exist in our city. The Illinois Medical District is home to one of the most diverse patient populations in the country, but we also serve a population that carries some of the greatest burden of cancer and other health disparities. The mission and aims of the Chicago Cancer Health Equity Collaborative is a bold step towards leveraging the academic excellence that exists among the 3 institutions participating in this collaborative, along with the community resilience that is present in so many of our community areas and the community partners that will benefit from this grant. This is a time in healthcare where collaborations and integration of care, research, and training are vital. The Illinois Medical District has a rich and active history of advocating research and community engagement, and we are actively connecting the significant bench research, clinical research, and innovative companies within the medical district to the community that should be benefiting from this innovation. The mission of the Illinois Medical District is very complementary to the Chicago Cancer Health Equity Collaborative, and we are so proud to be at the table with all of you together as we look to promote meaningful discovery, education, training, and community engagement. Thank you again for your time.
The next person we're going to hear from is Representative Marcus Evans from the 33rd District.
Thank you, Dr. Wynn, and thank all of you all for allowing me to take part in this great event. $17 million, wow, it's really gonna make a difference. In Springfield, I'm committed to continue to push for funding, whether it's breast cancer screening, whether it's programming to help folks stay on the right track in regards to health. I'm trying to get my words together because it's very emotional for me. I am a 9-year cancer survivor myself, non-Hodgkin's lymphoma. And it's always something to talk about these things because 9 years ago, at the age of 21, I was going to all of these various hospitals trying to figure out what was wrong with me, and I ended up at Christ Hospital, Advocate Hospital, and I had major surgery and 6 months of chemotherapy. And I just saw my oncologist last week, and I got a continued bill of health. So I got another year where I continue to fight for the people of my community, for the people of the South Side of Chicago, and all over the state of Illinois. So I thank you for doing this. And let's be honest, I didn't get a lot of A's in science, so it's not my job to try to solve the cancer issue, but it's to be that advocate, whether it's in Springfield, work with my congressional leaders to bring the resources to the facilities, to work with the hospitals, to work with great people like Dr. Wynn. Please, a round of applause for Dr. Wynn. Thank you. And also to take that fight to the community. I'm elected to represent my community and to connect to the community. The professionals will cure cancer. We give them the resources. I'm committed, and many of my colleagues are, to give them the resources to the folks who can solve the problem, but also to encouraging you all to plant the seeds. I'm one of the youngest members of the General Assembly, and that's the reality because 13 years ago, I got involved in politics, and it planted the seed, and that seed grew. So we got a young man somewhere in the South Side of Chicago, somewhere in Burnham, somewhere in Calumet City, somewhere in Inglewood who wants to be a doctor, who could potentially be that person to cure cancer, but we need to plant that seed. That resource has to be taken out to the community, to our schools, and I'm talking elementary and high schools, so we can have that person. So continue to push the fight, to plant the seed, and I'll be committed to being that voice for you in Springfield. Thank you.
Someone who is a tireless champion for all, and is someone that I have had the pleasure, honor of meeting over the last couple of years since I've been here, moved from Colorado, was Alderman Solis. And so Alderman Solis from 25th, could you say a couple words?
Well, let me say good morning, buenos dias, and ni hao. You know, I want to emphasize that morning, this good morning that I've just said to you, because I'm the very proud alderman of communities that include Pilsen and Chinatown and Obla Homes. I've got a few other communities other than those three, but these are the three that I think are going to have most of the impact of this great collaboration that we're celebrating today. So I want to congratulate these three universities and thank them. Also thank the funding source, because $17 million is a lot of money. But Chancellor, I want to sort of echo at least two people that spoke earlier, and thank you so much for the hiring of Dr. Nguyen. He's been tremendous. He's been all over my neighborhoods in my ward. He's talked to people like Slim Coleman, who has a fantastic program that I'm wholeheartedly supporting called 5+1 = 20, and I'll let him explain that to you later during the session. He's met with a support group of women who are cancer survivors. Dr. Nguyen has done that, and she's working with them. And I think you've met with the local high school here that is now a health careers high school that I think is going to make a tremendous impact in our communities. But like the representative said here, I'm here not only to congratulate and thank you, but also offer my commitment that as far as an alderman in the city of Chicago, and as a representative of these neighborhoods that I'm talking, I'm here to commit my support for that and to convince my colleagues and our mayor to support this, because this is basically a life and death issue that we're going to make a big difference with. So thank you very much, and congratulations on your big effort. Thank you. And I've got my son's parent-teacher day in about 15 minutes, so I have to go.
So I'd be remiss if I didn't ask Dr. Simon to stand up, please. And please join me. And, come on. So as I learned from my son, who's about 16, there's a vernacular that says, "Don't get it twisted." So I want to make sure it doesn't get twisted, and that the champion who drove this, who called us, who brought us together, who at times shared frustrations and some tears, but really who was a visionary in the concepts of having the three of us come together, is standing right next to me, just to make sure we don't get it twisted. So, Dr. Simon, I want to give you personally.
It's just not one person. This takes a village. This takes years and decades of all the work that all of you here and those who couldn't make it today have been working tirelessly to do this. And this is just one more thing that we can do, that we can elevate and champion and keep moving forward the good work that we do all together. And that's the point. It takes a village. It really does. So
absolutely. And it takes a couple chiefs, so. So thank you so much. Also, I wanted to make sure that we also recognize that the Latin American Consulate General folks from there were here to support us, as well as Esther Wong from CASTLE, China's American Service League. And I wanted to do something, I just want to try this out. I want everybody that's a community partner or even wishes to be a community partner, could you stand, please, just right now? Yaha, now that's what I'm talking about right there. So thank you. So thank you so much. Thank you all for being here. You know that we're going to transition to a town hall. So I think we're going to take a little bit of a 5-minute break, and then we're going to reassemble in the town hall. We hope many of you can sort of stay, but most important, thanks.
One more thank you. There is a huge thank you to all the behind-the-scenes people who have worked tirelessly to make this event a dream come true. So thank you so much to my team, to the team at Northeastern and the team at UIC. And thank you, really. This could not have been a reality.
And I think with that, we will get our 5-minute transition and we'll reassemble for the town hall. Thank you very much again.